Good morning, ladies and gentlemen. It gives me great pleasure to welcome you to ISIS Malaysia and to this two-day conference on growing the economy and meeting the care needs of the Malaysian society. We have appointed Professor Datuk Dr. Denison Jayasuriya, who is a senior visiting fellow at ISIS Malaysia, to convene this conference and an upcoming publication that will arise from the paper presentations and discussions. Professor Denison comes to us with a wealth of knowledge as an academic as well as a practitioner in social work at the grassroots. This conference is an extension of a series of roundtable discussions on conversations on the care economy in Malaysia, held in June this year at ISIS Malaysia. The RTDs, hosted by Professor Denison, brought together 30 role players comprising various stakeholders from the government, academia, civil society, care workers, and private care operators. The discussions were fruitful thanks to the support and participation of all who attended. Acknowledging the shifting demographics in Malaysian society and those in need of care, this conference takes on the approach of focusing on specific target groups while also considering the role of key enablers within the care economy ecosystem. At the heart of it, how can the nation provide better and equitable care for all, both in policy and practice? Over these next 2 days, there will be opportunities to hear views and experiences from the paper presenters who are subject matter experts, practitioners and researchers. Each paper will be reviewed by discussants who are key stakeholders from the ministries and subject matter experts who are practitioners from the private sector, non-profit organizations, and academia. As discussions and action plans on the care economy continue to be a priority at the national level, this space for purposeful discussion, thoughts, and reflections is timely and necessary. I'm happy to know that this conference will focus on 4 important segments with a total of 8 paper presentations. The 4 segments are the care economy as it stands. This will provide an overview and consider legislations, regulations, and issues of governance related to the care economy. Care for vulnerable groups. This will focus on older persons, persons with disabilities, with a focus on program pemulihan dalam community, otherwise known as PDK, children in need, and people with mental health concerns. Care workforce. This will evaluate the professional standards and training for the social care industry. And finally, looking ahead. This will cast a vision for the future on how the care economy can be an engine for growth in Malaysia. ISIS Malaysia has been at the forefront of care economy discussions with the launch of a policy paper, Building a Cradle-to-Grave Care Economy for Malaysia, which I commend to your reading. This important policy contribution calls for a life cycle approach to care and ensure that care services are a public good. More recently, at Praxis 2024, ISIS Malaysia's flagship conference, a session on integrating health and social care for Malaysia's care economy, highlighted the need to shift towards adopting promotive and preventative measures critical to meet care needs with a focus on the elderly. The discussion also centered on the systemic reforms necessary to facilitate the preference for aging in place, including financing options and social protection. The need for a multi-stakeholder approach in shaping the care economy has never been more urgent. The role of the public sector, private sector, voluntary sector, academia, and those who lived experiences are critically important to strengthen the policy environment and provide better access and quality care for all in Malaysia. I take this opportunity to acknowledge and thank you all, the paper presenters, discussants, moderators, and delegates for your time and participation at this conference. I wish you all well and look forward to the publication arising from this conference. Thank you.